Well, meantime, there's a new warning from the FDA over certain pregnancy, ovulation, and UTI tests. At least 15 different products made by the company called Universal Meditech are potentially ineffective. Adding to the problem, the fact that these tests were distributed under various brand names and they're not necessarily identified as Universal Meditech products. So here with us now to discuss what you need to know, Dr. Sujatha Reddy, an OBGYN at Premier Care for Women in Atlanta. Dr. Reddy, thank you so much for joining us for day two. Not good news, though. What is the biggest concern when it comes to these tests?
Yeah, so the problem is this company essentially went out of business. Now the FDA is saying they can't test the test, so to speak. So they can't guarantee their safety and their accuracy or if they work, essentially. So the fear is if you're relying on these tests to decide if you're pregnant or if you have a urinary tract or bladder infection, that could be a concern. I think the take home message here is throw these away, don't rely on them. If you used one in the past or you think you may have and you don't feel well, absolutely contact your healthcare provider. Or if you think you're pregnant, contact your healthcare provider.
All right, Dr. Reddy, that makes sense. I think what really stood out to me here, I understand that the FDA cannot guarantee the effectiveness. When I saw that they cannot guarantee the safety, that's what kind of set off some red flags with me. What are the safety concerns?
Well, I think essentially the safety is just going to be that you may rely on this test. I don't think it's going to harm you to do it because these are things you're either going to, either pee on or test your pee with, or they're not going to harm you per se. But if you're relying on them to say, I have pregnant or I have a bladder infection or I have a vaginal infection, then it might be dangerous if you ignore your symptoms. I think to use any at-home test, whether it be recalled or not, is just one level of care. If you continue to have symptoms and not feel good, regardless of what your at-home test says, you definitely should seek further attention.
And Dr. Reddy, that leads me right into my last question for you, because we know obviously these tests can be more affordable than an office visit when you more than likely have to pay your copay, et cetera, et cetera. But what is your general advice to patients when it comes to at-home tests like these?
Yeah, great question, Nicole. I don't mind the home test. We often will have patients do a home pregnancy test before we institute treatment or have them come in per se to confirm a pregnancy, but I wouldn't rely on them whole and soul. Even if someone comes to me having done an at-home test, when they come to the office, I am going to, verify it with my own testing modality. But you're right, they can be cost effective. And if you're traveling or perhaps don't have healthcare insurance, I think it's an option, but I would not rely on it 100%, obviously.
All right, you heard it there from the doctor's mouth. Dr. Reddy, thank you so much for your time.
Thank you, Nicole.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.